the Windsor definition and why you need to know about it. My name's Lindsay Salmon, and I'm the Community and Engagement Manager at Pregnancy Sickness Support, the only registered charity in the UK supporting women with pregnancy sickness and hyperemesis gravidarum. Pregnancy sickness. What comes to mind when I say pregnancy sickness? Perhaps you automatically turn it into morning sickness in your head, like a kind of reflex. It's likely that you have a frame of reference for it, though, an understanding of what it is, what it looks like, when it happens. I mean, the clue is in the title, pregnancy-based sickness. It's not rocket science, and it affects 90% of pregnancies, so it's pretty commonplace, and in most cases it's considered a normal part of pregnancy. It can happen at any time of the day, and in mild and moderate cases, women and birthing people can carry on their lives as usual with perhaps a few minor adjustments to their eating habits and routine, and it usually only lasts around 12 weeks. What about hyperemesis gravidarum? Have you heard of it? Maybe you think of it as that thing that Princess Kate had. We hear that a lot in our community. Or maybe you've heard of it from your midwifery training, or perhaps you've come across it in your work in maternity. Do you know what it means? What it actually is? What it looks like? How to spot it in your patients? Because women suffering with hyperemesis definitely aren't experiencing normal pregnancy sickness. And as midwives and those on the front line of maternity services, you need to know the difference. This is where the Windsor definition can really help. Hyperemesis gravidarum, which translates from Latin as excessive sickness in pregnancy, or HG as it's commonly known, is an extreme form of pregnancy sickness. It's fairly common, only affecting around 3% of pregnancies. But that's still around 30,000 women a year in the UK alone. It's characterised by severe nausea and vomiting up to 30 times a day. In many cases, for the entirety of pregnancy, hyperemesis is at the severe end of the pregnancy sickness spectrum, but it doesn't really compare to normal pregnancy sickness at all. So knowing the difference is key to providing the best possible care to the women you are looking after. So why do we need a definition of hyperemesis? As hyperemesis remains a clinical diagnosis with no clear biomarkers to either diagnose it or rule it out, it's essential that there's agreement about what hyperemesis looks like for both patients and the medical community alike. Until the Windsor definition was agreed, this varied from country to country and NHS trust to NHS trust, leading to a postcode lottery for sufferers. So picture the scene, if you will, where a woman is vomiting every time she moves, or gets a waft of the cooking smells drifting up from the kitchen, or attempts to sip any liquids. She feels nauseous every second of every minute of every hour she's awake, and yet she thinks this is normal. This is just what pregnancy's like. She hasn't eaten more than a couple of bites for days and can barely keep down an ice cube. Is it any wonder 50% of women suffering with hyperemesis consider termination? Is it any wonder around 25% of women suffering hyperemesis have suicidal thoughts? Can you imagine feeling this unwell for weeks and weeks and weeks? Even with antiemetics, the symptoms often persist, with nausea often quoted as the hardest symptom to deal with by sufferers. If this woman presents at her GP, midwife, or early pregnancy unit, it's essential that those frontline staff know that what she is experiencing is not normal pregnancy sickness. They need a clear set of diagnostic criteria that can be applied to clinically diagnose hyperemesis and rapidly commence appropriate treatment in line with the RCOG Green Top guidelines. The Windsor definition provides a standardised approach, which is essential for midwives and maternity care professionals, offering a clear, evidence-based set of criteria for diagnosing hyperemesis. Early and accurate identification of hyperemesis can lead to more effective management strategies and lead to improved maternal and fetal health outcomes. And that's what we all want. We know that before IV fluids, hyperemesis was the leading cause of death in early pregnancy. And whilst it's rare for women to die in the UK, it's sadly not unheard of, which is a tragedy. Whilst in many cases the physical symptoms of hyperemesis end when the baby is born, the mental impact can leave wounds that take a lot longer to heal. Around 10% of hyperemesis pregnancies end in termination. And this is a conservative estimate, as there's still a lot of shame and misunderstanding about termination for medical reasons. The outcome for these babies and their mothers is the worst case scenario. And with timely and appropriate treatment, many could be avoided. This is why a definition of hyperemesis is so crucial, so that women can access the care and treatment they need when they need it. The Windsor definition is also essential in establishing uniformity within research, so that research cohorts are consistent and the research that's carried out has maximum value. Research has identified that not having a clear definition of hyperemesis devalued some of the research that's been carried out due to inconsistencies in research cohorts. With limited research into pregnancy sickness in general, it's vital that every piece of research really counts. So what is hyperemesis? What is the Windsor definition of hyperemesis? The Windsor definition is the result of an international collaboration into HG research. Whilst this was the original driver behind this piece of work, it's also important from the perspective of sufferers that there's a consistent approach to diagnosing hyperemesis, as the ambiguity has proved to be a barrier to treatment. Women and birthing people who are suffering with hyperemesis often struggle to get a clear diagnosis, especially those who aren't hospitalised or experienced what we would call dry HG, where there's limited vomiting. Inconsistencies in diagnosis can lead to women suffering unnecessarily, not having access to medical treatment that they desperately need. In turn, this can lead to complications, both physically and mentally, costing sufferers and the NHS dearly. The Windsor definition is essentially a set of criteria, each element of which must be met in order that an HG diagnosis is confirmed. The definition was agreed as the start of symptoms in early pregnancy before 16 weeks gestational age, nausea and or vomiting, at least one of which is severe, an inability to eat and or drink normally, and it strongly limits daily living activities. Whilst this may seem like a very simple set of criteria, it has been crucial in establishing a standardised, evidence-based approach to diagnosing hyperemesis. According to Janssen, one of the authors of the research, the use of the Windsor definition will increase uniformity in research and improve the value of evidence to improve patient care. So why is it so important? Firstly, the Windsor definition validates that hyperemesis gravidarum is a separate condition to normal pregnancy sickness, worthy of its own name and its own set of diagnostic criteria. It's not just severe pregnancy sickness, it has its own name. As a previous sufferer of hyperemesis, I felt vindicated to know that I had a real condition and that it wasn't just suffering with pregnancy sickness and handling it badly. Prior to the Windsor definition, there were differences of opinion on how and when to diagnose hyperemesis. This meant that some women and birthing people missed out on a diagnosis because they didn't present at hospital before 12 weeks. The lack of uniformity also produced inconsistencies within research cohorts, as some included those up to 16 weeks and some didn't. The clarification in the Windsor definition will prove invaluable for researchers. A key element of the Windsor definition is that it identifies that either nausea or vomiting needs to be severe in order to diagnose hyperemesis. This is so crucial, as it recognises that those suffering with severe nausea also require medical treatment and compassionate care. There are a significant number of women who experience something we often refer to as dry HG, which means that whilst they feel excruciatingly nauseous 24/7, they rarely or never vomit. In the past, this has often meant that these women and birthing people didn't receive a diagnosis of hyperemesis, as they weren't hospitalised or they weren't dehydrated enough. Some were refused care as their symptoms weren't that bad. But believe me, when I say that relentless nausea is as debilitating as persistent vomiting, it consumes your entire body and takes over every thought in your head. You literally cannot escape it. And it's silent. Nobody can see how nauseous you feel. So there's far less compassion offered to sufferers of dry HG. The Windsor definition recognises that both severe vomiting and severe nausea meet the criteria of hyperemesis and deserve to be treated not just with compassion from healthcare professionals, but also with medication and IV fluids where appropriate. I hope the integration of the Windsor definition in midwifery practice means that those suffering with dry HG can now feel validated and no longer stay in the shadows of care. The use of the term inability to eat and or drink normally is inclusive of the variety of women's experiences with HG. For many, water, along with many other drinks, becomes the enemy with its weird smells and revolting tastes. And even if they were a favourite outside of pregnancy, often women find that very cold drinks are more palatable, and bizarrely, fizzy drinks are easier to tolerate than flat ones. In some cases, women need to take sips of water constantly to curb their nausea, while others struggle to keep down so much as an ice cube. But nothing about this is normal. Food aversions are extremely common, with simply the thought of food leading to retching and vomiting. Often sufferers have a restricted list of safe foods, which can change with no warning. Decisions are frequently made about foods based on how they might feel coming back up. Again, there is nothing normal about this way of eating. The amount of food consumed by women during the peak of their hyperemesis symptoms is barely enough to sustain one person, never mind a person growing another person. Antiemetics can really help improve appetite and curb food aversions, and they really need to be considered as early as possible. One of the most powerful elements of the Windsor definition is the inclusion of the psychosocial impact of hyperemesis. Yes, of course, the physical symptoms are a major issue, and without treatment can lead to serious complications for mother and baby. And we know that prior to the introduction of IV fluids, HG was the leading cause of death in early pregnancy. But there is a far broader and longer lasting impact on sufferers and their families. The phrase strongly limits daily activities can incorporate almost anything that women are no longer able to do while suffering with hyperemesis. These can include work, looking after their children, cooking, cleaning, meeting with friends, supporting their partner practically, emotionally, or financially, maintaining their own personal hygiene. The list is almost endless. Women are left feeling like they've lost their identity because who are we without our work and without looking after our children or being there for our partners? This loss of identity and the guilt that comes with it can have a devastating effect on women's mental health, and midwives and healthcare professionals need to be aware of this. Hyperemesis often leaves women unable to work, and this can add financial stress, particularly if their partner then has to take over some of the childcare. There could be a knock-on effect to maternity pay if women are off during those crucial weeks where maternity pay is calculated, which increases stress levels for families. Hyperemesis really impacts every area of a woman's life. It leaves no part untouched. The inclusion of this element of the criteria is really crucial to taking a holistic approach to hyperemesis, something that midwives are really well placed to do. When considering the women in your care, you need to not only establish the physical symptoms like the fluid intake, inability to eat, the number of times they vomit, etc., but also take into account the impact on the woman's mental health. Having hyperemesis can feel like your whole world stops. Everyone else's carries on as normal, and the isolation that leads to can feel miserable. Hyperemesis can feel like living in black and white, like an old TV, because it sucks the joy and vibrance from every aspect of a woman's life. The impact on sufferers results in significantly higher rates of antenatal depression, not to mention the long-term mental health impacts of postnatal depression and PTSD. The new RCOG Green Top guidelines being published in early February include a focus on hyperemesis sufferers' mental health, which has been welcomed by our charity. The guidelines also recommend the use of diagnostic tools such as the PUC score, which stands for the Pregnancy Unique Quotient of Emesis, or the HELP score, which includes questions about mental health along with physical symptoms, like number of times you've vomited. These tools work seamlessly alongside the Windsor definition and will improve outcomes for sufferers and their babies across the UK. So why do you need to know about the Windsor definition? As midwives and healthcare professionals working on the front line in maternity, you will come across women who are suffering with the full spectrum of pregnancy sickness. And so it is vital that you're able to identify those women whose experience is outside of normal. In using the Windsor definition, alongside tools such as the PUC score to diagnose hyperemesis, you're guaranteeing that women across the UK are assessed using consistent criteria, and this in turn will lead to early identification and intervention for those with hyperemesis. The new RCOG guidelines on nausea and vomiting in pregnancy include the Windsor definition as the diagnostic criteria that should be used for hyperemesis. The guidelines are vital in establishing standardisation across the UK and provide both healthcare professionals and patients alike with clear treatment guidelines and expectations of care. It's hoped that the inclusion of the Windsor definition into these guidelines will ensure a more uniform approach to diagnosing hyperemesis and improve maternal and fetal outcomes. Make no mistake, hyperemesis is traumatic, and that trauma is often compounded by a lack of understanding of the extent of the woman's suffering from friends, family, and frequently medical professionals. The impact of trauma far exceeds the 9 months of pregnancy, and we hear time and time again about the challenges hyperemesis sufferers face long after their babies are born. By recognising, diagnosing, and treating hyperemesis early, you can mediate some of the trauma experienced by women, and this will stay with them far beyond pregnancy. With knowledge of the Windsor definition, along with diagnostic tools such as the puke score that you can apply consistently in your practice, you are providing the best possible care to the women and birthing people that you look after. In using a clear definition of hyperemesis, you will guarantee that you're using the most up-to-date, evidence-based information to diagnose and treat women with hyperemesis. This will ensure that these women will get the consistent care, compassion, and medical treatment they deserve and desperately need, which in turn will lead to better outcomes for mothers and their babies. In the words of the formidable Maya Angelou, do the best you can until you know better. Then when you know better, do better. Thank you so much for your attention.